There we go. Hey, everybody. We are live on YouTube and a couple different Facebook platforms. It is Friday, June 6th, and today on the Mental Health Warriors, we are talking about shattering the stigma of mental health. And we are going to kick off with our intro, and then we will be back. There we go. Well, welcome everybody to the Mental Health Warriors. Today we're talking about shattering the stigma of mental health, and we've got myself, Ashley Balza, the self-care mama, as well as Dr. Gilly and Tammy. Is it Vincent?
Yep.
Yes. Okay. Wow. Richard might be joining us today, but if not, you get us beautiful ladies tuning in today. Make sure that you also hit the like and subscribe button on our YouTube channel and share this across your social media platforms. But let's kick it off today with our guest, Tammy. Tell us a little bit about yourself and what it is that you do and how you help the mental health community.
Okay. Well, thank you, Ashley, for having me here today. I'm honored. So, I am an NLP practitioner, and the best way to put my title is a trauma informed ACOA empowerment coach. So, I work with primarily adult children of alcoholics and dysfunctional families, and shattering the stigmas is what I am so passionate about. So, I work with them just to unravel all of the everlasting effects of growing up in that kind of dysfunction, and just kind of helping them navigate life as an adult with, let's say, misguided direction as a child. So I have I do coaching, I do podcasting, I have my own podcast, and I do speaking. So
I love that. Thank you for sharing that. And then obviously we've got Dr. Gilly, and it's been a while since, we've seen each other because I haven't been here in quite a few weeks. But Dr. Gilly, let's refresh our audience, if you will, and tell us a little bit about what you do as well.
Sure. Yeah. So I'm here on Mental Health Warriors, just helping out and just like talking every few weeks. So once in a while, we'll run into each other. But I'm a clinical psychologist and I specialize in neurodiversity. My practice is mostly with teens, but I see adults and younger kids too. And I just published my first book. It's titled Allow Me to Interrupt. A psychologist reveals the emotional truth behind women's ADHD. Shameless plug. But yeah, it's available for pre-order and will be released in September. But yeah, I'm a writer too, and I'm a mom to 2 little kids.
I love that. I love that. That's so awesome. Congratulations on publishing your first book. How exciting. Okay, so I guess let's do some deep dive, if you will, as to what are some common lies that you see, or maybe you've heard either clients or even you've told yourself as far as mental health, just in general. Like, is it something like, well, this person is worse off than I am, so it doesn't matter if I share what's going on in my life, or like, I'll just deal with it later type of lies, if you will, that you often hear from your clients?
who do you want to start?
Whoever wants to jump in, go for it.
I can say one of the biggest things I hear, and one of the, I guess, most common myths that keeps people from coming out to getting help, is that nobody would understand my story is so unique. I'm the only one. And that is one of those it's a big misconception because everybody thinks, no, they don't come forward and they don't want to talk and they don't want to get help because they think they're the only ones in the world that has ever gone through this experience. And I try to get them to explain your experience is unique to you, but somebody has gone through it. So you can come out and you can get help and you're not alone.
Yeah, absolutely. Dr. Gilly, what have you run into?
Yeah, I mean, I can see that specifically happening more in the population, like the group that you work with. I think the group I work with, they're more confused, the parents too. So they aren't necessarily asking or saying we're the only ones, but when they talk about it, I think confusion definitely comes out, and there's a sense of there's something wrong with this, or there isn't a way to explain this. And that's when I come in, validating and explaining that there's a lot of other kids I've worked with in similar situations, and so they're not the only ones.
Mm-hmm. Yeah, for sure. Well, and I think even as like a self-care coach for moms, it isn't just the mental health portion of it, it's just all around as a mom that oftentimes I hear moms say, "Oh, I thought I was the only one going through this with my kids." Or so I think it's more encompassing than just mental health. But I feel like why, and this is often a question I ask myself, why as a society do we feel like we have to go it alone? Like, do you have an answer that you explain that to your patients of or your clients of why? Why do you feel like you have to go it alone?
I
Is
think
there an
it may
answer?
be, I think a lot of it has to do with like terminology and
Mhm.
knowing that there's a word or a phrase that exists to describe what people are experiencing. And I think, I have like a background like academia, but also I'm a clinical psychologist now. So I think, I kind of like have a sense of like how researchers approach like new constructs or like new words or phrases. For example, in my book, I talk a lot about rejection sensitivity dysphoria, or RSD. And that's like a cluster of symptoms that is now shown to, occur in people with ADHD. And it's basically like extreme sensitivity to perceived or actual criticism by others, which makes sense because people with ADHD tend to be criticized by others. And so then they internalize that and they create these thought patterns where they just kind of assume that they're going to be rejected. And, so a piece of it is like neurobiological. It's a part of like how their brain already functions to begin with and what they're already sensitive to, just like innately. And then there's also the environmental piece that reinforces that. And so, like the challenge I ran into in the beginning phases of writing my book is that there were even, I think maybe when I just came up with the concept, there weren't any studies on rejection sensitivity dysphoria. There was just the lectures of Dr. William Dodson, who's the psychiatrist who popularized the term. And because of that, there was a lot of criticism, like this hasn't been studied in real life situations, or there hasn't been like any data gathered about it. And so there have been like warnings, like you could just like smack like a warning label on something. Same thing with like ADHD paralysis. That's another term that has sort of took off, on social media, but it's not like a clinical term. It's not a symptom. Now there have been a few studies on RSD, but it really sometimes takes like, pulling teeth to get in the research space to get there to be progress in that area, because initially they view it as like a social media or like a media sensation. So it's irrelevant to ADHD. But if a lot of people are hearing a description and they're saying, yes, that sounds familiar, I think that's me, I think it's worth studying. And what I found, at least in my clinical practice, even before it was formally studied in research studies, is that it really benefited people to have a name for what they're struggling with. And I've had people even cry in my office when they heard the term. They're like, this is something that exists. And so I was just like, I'm going to write a book about this because I felt like no one knew about it. And it was very validating, especially for women with ADHD. So I think if we can describe things in words to people, language could be really powerful and very validating and help you feel less alone.
And I agree. And I think there's a lot of controversy and just different perceptions of the same thing. Like I was just on a podcast before we got off here, and it was a coach that works with neurodivergent mothers who had like a late diagnosis. And one of the big talks was like, is the neurodivergent, like, does that include things like childhood trauma and how your brain has been rewired? And it's starting to just kind of just, we knew it happened. It's like, it's not like it's a new thing. None of these are new concepts. It's just whether they're looking at it from more of a psychological or like a physical even standpoint sometimes. And that, like we were talking about that, like a lot of people, I've had a psychologist tell me, no, neurodivergent, that doesn't fit into CPTSD. And I'm like, that's very confusing for someone who has been diagnosed or potentially been diagnosed with like ADHD or bipolar disorder when they have all of the same symptoms, but it comes from nurture versus nature. You know, it's kind of like that discrepancy and like what is it? And I think, like you said, putting it in words and giving it a way to actually describe it and give it a word gives a little more validity and makes people more understanding of it.
Right. Yeah. And like, okay, so if you could speak to somebody that would be suffering silently or that's silently struggling with their mental health right now because of, again, that languaging, or they feel like they're alone and they don't know where to go or who to confide in, who they can trust, what would you say?
Do you want to start, Dr. Gilly?
Who could you go to? Yeah, I mean, it depends. You know, I think the easiest person to go to would be someone you don't have to pay. So like a friend, right? Or a friend or your romantic partner, someone you really trust. But it depends on what the issue is. If the issue is their romantic partner, maybe they shouldn't go to their romantic partner. It just depends. I mean, it would be ideal if they could, you know, but if it's concerns about, you know, things where it would be much more beneficial or helpful to talk to someone who's more neutral, then you could talk to a friend, but then that friend wouldn't have to have any ties to your romantic partner. So it really just, it becomes sticky and difficult, like when you're looking at your natural just relationships. But I would say the easiest thing to do is to go talk to a friend you really trust. And then the next step that is really helpful, you know, for example, I was working with someone recently who lost a family member. So I was saying, who have you been able to talk to? Like I asked them, and they said, well, friends, not so much. You know, they could be a little bit immature, not really know what to say. You know, when people are grieving, like a lot of people say the wrong thing. Like they'll say, you know, well, at least that person lived a long life and you got to spend a lot of time with them, right?
Or they're
Or
in a better place. That's the
they're
word.
in a better place, yes. Or you have like at least you have like very good memories of being with them. Those are like the at least, you know, or I don't know. Like, you know, they'll say things where they're trying to be helpful, but they're really actually not. They're making it worse. And so people who aren't necessarily like trained as a coach or a therapist, right, or a psychologist or even like a psychiatrist, like they might not necessarily understand that the best thing to do is really just to listen and be there for the person and tell them that you care about them, and that whatever they need, like you're here for them. Like that's it. It's that simple. So that's where seeing someone who's trained, who has some expertise in working with people who struggle in general, but then even better if you can find someone who specializes in whatever you're struggling with, that's where it becomes more helpful to hire someone and to work with someone like that. The other thing I'll say too is that there's this misconception that like you're paying your therapist or you're paying a coach, then they don't really care about you. And that is such a lie. Like we really do, it's just that we went to school for many years and this is our job, just like anyone else's job, but we picked this job so that way we can just do this all the time and also like put food on the table.
I would say too, honestly, like especially if you're kind of confused or you're just starting to hear this verbiage or you're just starting to resonate with this stuff, is get on podcasts, listen, like type in whatever you think your issue is and say podcasts about, and listen to some of the experts. You can get amazing advice from doctors, psychologists, therapists, coaches, whatever, and just kind of soak up, like be a sponge, because you'll learn, and your subconscious hits you in different ways. So if you're sitting there and you're listening to something and all of a sudden your whole stomach like clenches up, you're going, "Ooh, that might be something I should pay attention to." Like your body is going to physically react to different things you hear, and it can steer you in the right direction. But definitely, like you said, once you get to that point where you're like, okay, this is what I need, find somebody qualified and somebody you trust. Because I tell people, when you're picking a therapist, a psychologist, a coach, whatever it is, try to find someone that is literally, I mean, I like to say lived experience. But I remember my first coaching client said to me, "Tammy, I've been going to therapy for 11 years. And in 18 minutes, you just told me more about why I am the way I am. And one simple thing that literally changed my whole life." And I said, "Because I was you." Like, so find someone you trust and someone you resonate with, because that's so vitally important.
I think
Yeah.
Adam asked a very good question there. Maybe we
He
should.
did. I'm gonna pop that up on the screen. So Adam said, "Why do parents, especially moms, bottle their mental health struggles and choose to get on with it rather than talk about the struggles?" That is such a great question.
A million different reasons. I think one of the biggest, I mean, I don't want to, I used to say people don't go to therapy because they either don't have the time, they don't have the money, or they don't want to be seen walking into it. I mean, talking about what we're talking about with the stigma, moms are superheroes in people's eyes. They have to stand tall and tough and strong, and they just push through. Maybe it's not that they don't want to talk about it, but it's almost like if they do talk about it, they're going to break down and they're never going to stop crying. You know what I mean? They just push through until, I hate to say it, but so many of them do it until they're completely burned out or have a complete mental breakdown because they've just overwhelmed their whole body and nervous system so badly. But I think a lot of it is just because they don't want to be a burden. I mean, they're the caretakers. They're the person that's supposed to be taking care of everybody else. They're not used to being like throwing up their hands and being like, "Help me." And I think that's a big part of it.
Yeah, I would concur. And I think that's a lot what I see with my clients. And that's a lot what I talk about is the burnout and the exhaustion. And one of the things I started talking about within my community is wearing that resilience like a badge of honor. And then the resilience, because everybody starts seeing you as, oh, you can do it all, and you're juggling this and you're juggling that, and I don't know how you do it. And then we silently struggle because then that badge of honor of resilience and that term resilience, it becomes the thing that burns us out. Because then we feel like we have to constantly wear that identity. And if somebody sees that we don't have that identity on, then we must be a crap mom, or like, what do you mean you can't do it all, and what do you mean you're struggling? And it's this view of the again, that superhero, yes, like vision, but then there's no vulnerability in it. And that's one of the things I think that I always, in true honesty, pride myself on, is being vulnerable with my audience. and not wearing it like this, oh, everything is happy go lucky, look at my perfect house. Like, no, I don't want that mask that people are seeing. Like, if I'm having a crap day, you're going to know I'm having a crap day because I'm a human. And I want moms to be able to drop that mask to be like, yes, I relate to that. Like, you've got all this going on, and yet you're still taking time for your mental health, for your self care, for whatever that looks like, versus, okay, yep, I'm just going to buckle up, buttercup, because here we go type of a situation. And I want moms to be related to.
And I love, like, I always start my conversations like, how are you today? And remember, it's okay to not be okay.
I love
Like,
that.
literally, like,
Yes.
it's okay. Like, how are you today? Don't come back without even thinking and being like, fine.
That's a great book on grief, by the way. It's okay to not be okay. That's the title.
Oh, I love that.
I love that.
Yeah, it's not mine, but it's great.
Yeah, I mean, it's so true, because you can some people can be having the worst day, and you say, how are you? And they're like, fine. No,
Yeah.
so I always like, how are you today? And remember, it's okay to not be okay. So
Yes,
that it gives
yeah.
them that, oh, wow, I can actually honestly tell you what's going on. I've just opened that door for you. So take it, walk through it.
Yeah. Well, and I think even as a society, it's so much of this. While if I tell you what's really going on, one, it's going to expose me, but two, do you even really care? Because so many people are so wrapped up in themselves that I think if we open the door of, like you said, Tammy, it's okay to not be okay, and you drop the fences, letting people know, like, it's okay. Like, I'm a trusted person that you can come to versus, yeah, oh, okay. And you're just kind of superficially like caring about what people are telling you. Like, there's a big difference. So I think that boils back to telling people that you trust, or finding people that you can trust and you can be vulnerable with. It is also a big thing. And sometimes it is a stranger, like, that you make a connection with, and it just brews into this beautiful relationship. So it really just depends, I think, too, of what intuition. And Adam followed that up with, um, I'll put it on the screen. He says, I agree, and I see the same thing with dads also. And some turn it into aggression because this is the only way we can express how we feel. Um, so I guess, do either of you have something, or both of you, um, something to piggyback with that, as far as even dads? Like, yeah, we talk a lot about moms, but I think those silent strugglers most times too are dads as well, because they don't know how to process emotions. They're always told, no crying, like, be tough, and that's not okay to show emotion or feelings.
No, one of my favorite podcast episodes was with a gentleman called Michael Morgan. And he was a first responder who had just seen some horrific things, deaths all the time. He was in Atlanta. And he talks about when his dad was the stoic, tough, you men don't cry, real men don't cry, suck it up, buttercup, like, take it like a man. And he became a first responder. And literally it was like after he had to witness a 2-year-old drowning in a pool, and he lost it. And it was like he sat down, and like every single thing that had ever happened came back to him. And I mean, even on my podcast, he's bawling like a baby. And he talks about, guys got to let it out. Like, they have emotions too. And if not, like Adam said, it's going to turn into aggression. It's going to become something that they can't handle. But he talks about he does talks all over the place about just men being vulnerable. He said when that baby drowned, if he could have gone to behind that house and just bawled like a baby and put his fist into something, he might have been okay. Because you got to get those emotions out. That's, when you talk about why people don't say anything, that's one of my biggest things with my clients is every time you take an emotion or take a feeling or take a thought and put it behind you in that backpack of things to deal with later, eventually that backpack is 1,000 pounds and is going to take you out. So unpack this stuff one at a time. And men, it's hard because men have that stigma. Real men don't cry. I mean, how many times have you heard that? And it's absolutely ridiculous. And I think it starts with little kids too, teaching them, it's okay to, I mean, emotional intelligence is one of the least sought out things in school. And it's like, why do we not teach our kids how to have an emotion, deal with it, process it, and be constructive with it? Because it starts at a very young age. But by the time they're men, they're the men. They're the man of the house. They can't cry. And it's just crazy.
Yeah. I think in general also like cultural differences matter here too, in terms of like what's appropriate for males versus females with emotional expression. Like at least like in Latino culture, for example, there's like machismo, and that's their version of like real men don't cry. But I guess maybe even more extreme. So depending on, the culture, that might also be heightened, this sense of needing to keep it together. But if you take a step back and also look just kind of more generally at differences between males and females and how they express their emotions, for females, it's a lot more linguistic, like they use language a lot more to express how they're feeling compared to men who tends to be more behavioral. So they show their emotions more with their behavior. And one thing I studied in graduate school is we were talking about constructs or terms, right? So it's called co-rumination. And we know what rumination is. Rumination is when we're alone and we're dwelling on negative or uncomfortable situations or things that happen to us. And we're just kind of sitting in the muck of those thoughts and those feelings. Co-rumination is that, but in the context of a dyadic, of a relationship with another person. The dyadic is two people. So when I was younger in graduate school, I studied this in the context of friendships. And then as I moved on, I studied this in the context of parent-child relationships, because Adam asked about moms. And basically, what you find is that between friends, when the dyad co-ruminates, when within the friendship, there's a lot of talking about problems and dwelling on problems and dwelling on negative feelings, it's sort of like a double-edged sword. So you would think like, oh, wow, that would make each person very depressed and anxious. And if you think that, you're correct, especially in female friendships. But it also has some positive outcomes because it's also associated with self-disclosure, which means like bonding or getting close to the other person in the friendship. So you're strengthening the friendship, but then at the expense of also increasing anxiety and depression for each person in the relationship. Now, how does this apply to the parent-child relationship? This gets tricky because a friendship is like a horizontal relationship, right? They're equals, they're peers. With a parent-child relationship, it's not horizontal anymore. Now it's vertical because the parent is the superior, right? And then the child is more vulnerable. The parent is older and the parent is responsible for the child. And so the child might feel a certain sense of like maybe restraint. So if mom comes to the child and starts talking about her problems, that only leads to problems. It doesn't necessarily even make the relationship closer. It just introduces problems. And so when you ask, why do moms bottle things up? It's not only bad that they bottle things up, it's also protective of their children. When you're thinking about the effect on the child by the mom openly expressing herself. But that doesn't mean that parents should never show that their children that they're sad. It's fine to talk about your problems with your kid, assuming it's age appropriate for the kid, because it can also teach them things. It could be a learning experience for them. But the point of a learning experience is that there was something to learn, because with co-rumination, you're just dwelling on the negative things without coming up with a solution. So if you come to your kid and you say, oh, for example, this happened to me recently. My friend died in this freak accident. And so she saw my daughter, she's 7, she saw me crying. And so she said, "What's wrong?" And in my head, I was doing this like fast calculation. I was like, do I tell her the truth or do I make something up? And so I decided I'm just going to tell her the truth. So I told her I had a friend from when I was really young. Now she's an adult. She got into an accident and she died. And I'm really sad that she died. And so I think the way that you kind of like frame it, I didn't sit there and keep talking to her about how sad I was and how it was the end of the world and how I will never see her again. Sat there and I told her, I'm really sad. I know this is part of life. This is going to be hard for mommy whenever she thinks about her, but also we can keep her in our lives, and then I tell her I'm going to visit her parents. Or, I show her like a picture or something that I have of her. And this is how I keep her in my memory. So as long as, you also model like healthy responses to your kid, then it's fine to tell your kid about your problems, assuming it's age appropriate.
Yeah, you do not want to use your kids as your sounding board or your emotional support, because then you just end up with a whole, especially like teenagers, you end up with these codependent relationships that just get so messy. It can get really messy.
Exactly.
Well, and I think too, like, it's a whole nother level of responsibility that the child feels, that they have to save their parent or whatever it is. And then when they get into a relationship themselves, like, it becomes this, this I have to save you type of a situation. I saw that a lot, like with my mother-in-law and my husband. Like, she was always in need of rescuing from something, and she's also an alcoholic and all the things. So it was one of those things that finally it came down to, we had to cut ties with her, because we can't rescue you. We can't keep saving you over and over again. Like, you are an adult and now you need to take responsibility for your own things. Now that we've got kids, and there's only so far you can go when somebody doesn't want to be helped, type of a situation. And I think there's a lot of onion that has to be peeled away for him to work through all of that. And it's a process for sure. And I've witnessed it throughout the years. And I think there's also a lot of blockage that happens when we go through those traumatic experiences, because you want to tune it out. You don't want to remember it. You just don't want to deal with it, kind of a thing. And then it manifests, of course, as other issues in your life. But what support systems, if you've dealt with your own mental health struggles and stuff, what type of support systems did you ladies have that even helped you along in this journey, or something that really drove you into what you do today?
I can talk about that. I remember when I was 26. I mean, my parents were both alcoholics. My mother was a drug addict. She pimped me out to drug dealers, and I mean, just not good stuff. And I remember being 26 years old, and I was reading that book, Love You Forever. I don't know if you've ever read that book. It's a children's book, and it's about a mother's unconditional love with her son. You have to read it. Oh my God. And I was reading it. I was 26, pregnant with my first child, and I was rocking back and forth and reading it, and I should have been this like serendipitous, like happy moment. And it hit me like a 2x4, because I didn't even understand unconditional love. I didn't have a memory of hugging my mother. I didn't have any of that. And that's what threw me into everything. So I went down, we didn't have the internet back then, but I went down to the library and just started going through stacks and stacks of books. Now, I had read a lot because my mother was actually a child psychiatrist, which is kind of ironic that she was so manipulative and abusive to her own children. But I had read a lot, but I was just like, you know what, I'm going to throw everything at the wall. I started in therapy and I went to a psychotherapist, and I tried everything. And I mean, it's 30 years later. I still try new things and they're cool, but it wasn't. I did 6 years of inner child work with someone. I would do the therapy on and off, kind of mixed in with other stuff. For my particular circumstance, I went to ACA. I started at Al-Anon and then I went to ACA, which is Adult Children of Alcoholic and Dysfunctional Family Meetings, for 18 years. I just did anything where you just get that support. You get to share your story. You get to talk about what you did. But I did everything. I did hypnotherapy. I did EMDR. I did, you name it, I tried it. I was like, we're going to throw every single piece of spaghetti at the wall and let's see what sticks. And I do EFT tapping. I still do it. I'll be with a friend. I'll be like, let's just tap it out. I mean, there's so many different, I think we're in a great world right now. There's so many different things you can do, like dance therapy and somatic therapies and therapy and, regular traditional therapy. And I did a lot, but I can honestly say my biggest breakthroughs came from when I was doing serious inner child work and journaling, like massive journaling, storytelling and ripping up paper and burning paper and throwing it in the river and like going through the whole process of releasing. And I did a lot of timeline therapy, different things. So it's good. We're in a world where you open up the book and that you can choose a million different things that you want to try.
Right. How about you, Dr. Gilly?
What was the question? Sorry.
So,
yeah.
No worries. So, like, what helped you in your healing journey, or what propelled you to decide that you wanted to do what you do today?
Oh, yeah, that's right. Okay. What propelled me in my healing journey, or what helped me decide to become a psychologist? I mean, it's kind of a tough question, because what helped me to become a psychologist was a traumatic event. But I think, that's probably true for a lot of people in the helping professions. They've gone through something and, they wanted to help other people cope with difficult situations. But I lost my mom to breast cancer when I was 4. And so I was, interested in the human mind and in psychological disorders. But initially, that interest came out more in writing. And my mom was a writer too, and an artist. She was a painter. And so for me, in middle school, I started kind of coping with the loss, because it's something that never goes away, especially when you're very young, and you lose a parent. I think maybe especially when you're a daughter and you lost your mom. And so it was hard for me. And so I would write a lot. And initially, I would journal, but then I found that when I journaled, it was too close to home. And so I started writing fiction, and I would kind of, put my feelings into the characters. So if anyone asked, like, oh, wow, this is like really dark, I'd be like, it's the characters, the story. But that was me. But I think people become like very concerned and you just don't want to talk about it all the time. So it started out like that with writing. And then when I was in high school, I basically decided, writing is a very unstable career, which it is, because I'm doing it now part-time. And I was literally just having a conversation with a friend, and she was like, it had been a while since we talked. She's like, so what's new? Like, what are you up to right now? I'm like, well, right now I just got off the phone with my agent and I realized how poor writers actually are. It's true. But anyway, because of that, I decided I would choose like psychology as kind of like my primary career. And then if writing works out, then great. And if it doesn't, like I have a job. But also it was related. It wasn't like I just kind of picked it randomly, because, the content I was interested in reading and writing about was psychological. And I also really loved working with kids since I was really young, and I wanted to help kids who are struggling, because I really struggled as a kid. And so, when Tammy said before, like, try to find someone with lived experience, I 100% agree with her. Like, whatever you're going through, I even do that as a psychologist. When I look for someone who can help me, I look for someone who has a similar experience, to what I'm looking to gain, whether it's like mental health or not. Like if it's book related, I'll look for my writing coach as a psychologist too. So, you pick someone who's similar to you, who has had similar experiences, because then that person can help you the most.
Yeah, absolutely. Um, is there um, is there anything that you can give as far as advice for the person that, again, is struggling to ask for help because they're living in that shame of asking for help? But is there a way or advice that you would give for them to really break free of the guilt or that shame of taking care of their mental health?
I think the best thing is that just if they're listening to this, if they're listening to a podcast, wherever they're hearing it, if they're not happy, just to know that they deserve to be 100% happy. And the only way they can do that, the only way you can be good for your children and their children and their children and all the next generations is to be pouring from a full cup. So you shouldn't feel guilty about wanting to be like, we all were put on this earth. It's like you want to shake people and say you were born this beautiful, divine, perfect creature. And then life happened and it made you think differently. But we all deserve to be happy. And I tell people, if you don't want to do it for you, do it for your children. Do it for your grandchildren, because as one generation heals, it heals all of the generations down the road. But it's just repeating to them every day how worthy, when I fill out a form, if you fill out a podcast form, the last question on everything is, do you know that you're absolutely amazing? And they have to check yes. And it's just, people just need to understand that they are worthy to get help and there's no shame in it. So, if people can't do it for themselves right now, because sometimes they can't, sometimes they don't feel subconsciously that they are worthy to get the help. A lot of times that's it. Tell them to do it for their kids, anything to prompt them to get in and start. But also just explaining to them that their story is not like they are not alone. Somebody out there somewhere has had the same, almost same, linear experience. They're not alone. But that's the best advice I can give is just tell them to treat themselves like their own best friend at every crossroad.
Right. Yeah. How about you, Dr. Gilly?
How to prompt people to succeed. About the question. Sorry, I have ADHD. Clearly.
Well, just no, it like those that are struggling with that shame and the guilt of asking for help.
Okay.
What piece of advice would you give them to break free from that?
Okay. I'm gonna start out with like a personal example, and then I'll work off of that. So I read about this in my book. Sorry to bring it up, but it's just like it's partially a memoir, so it's in there too. But I actually was diagnosed with ADHD as an adult, and I only started getting help for anything like depression, when I was an adult too. Before that, I felt like because I'm a psychologist, it might make me look like incapable or inferior, or maybe not someone who can help others if I'm struggling myself. And that has a lot to do with stigma. And I'm sure that a lot of other mental health providers could relate to this. And so it was, a fear. But then also it was not even like of sharing or with other people finding out. It was more this self-confirmation that something is damaged about me if I get a diagnosis. And, I'll say, at least from my experience as a psychologist who has diagnoses and as someone who works with people who have diagnoses who struggle, I think most people struggle with something. And you can only work on improving the things that are introducing, like, or slowing you down in life by knowing like what the starting point is, and by just finally feeling at peace with yourself and accepting whatever your mental health history is. Because, why is it okay to have a family history of breast cancer, but it's not okay to have a family history of depression? They're all neurobiological issues. And I think it's because of this like medical model, it makes it like maybe more okay to struggle with physical conditions in some circumstances rather than, mental health in general. And so I think it only gets better, most of the time. If you actually seek out a diagnosis and you start getting treatment for it. And I would also say, like, don't wait, like, don't put it off until it gets really bad, because you're basically like desperate by that point. And you've also spent so much of your life not working on improving things. So it's better to do it, as soon as you possibly can.
Right. What would it look like if we started treating mental health check-ins like regular doctor visits? Like it would be normalized, expected, and almost necessary. Like, what would that look like in society?
I think it would take a while to kind of come around, but I mean that now, like when you go to hospitals, they ask you if you feel safe, like, are you feel safe at home? They start to ask. I mean, I think that it might prompt a few more people. It's going to be, at first, I think it's just going to be questions. You're just yes, yes, yes. And you're going to say what you want people to hear, just like you're hiding it verbally, you're going to hide it on a piece of paper. But I think if it keeps going for a while, eventually maybe it'll turn to where people are like, okay, they're going to ask me this a million times and they're going to physically ask me. Like if they're going to ask me, maybe they really want to know. So I think it would take a while to kind of make that transition, but I think it would be a good one. Yeah. I mean, I love that they ask you, I love that they ask you, do you feel safe in your home? Because that's a vulnerable time and you're in the hospital by yourself without a spouse, without a caregiver, whatever. It's an easy time for you to say no and just kind of let the ball start rolling.
Right.
I think from like a parenting perspective, like if you can model to your kid that going to see a therapist and that mental health is like a normal thing to talk about and to have, like to struggle with, then that could be very impactful. I see it like with my daughter too, like with ADHD. She talks about it totally casually because she knows I'm writing a book about it. I have it, that it's genetic, which is all true. So there's nothing wrong with talking about it. And, in terms of like my perspective as a psychologist who works with families, I've seen like teens walk in where they walk in like it's a spa, which it should be, right? That was totally comfortable. I've had like a couple teens walking in. I've seen them for a long time, granted, but like they'll walk in and like dance in the waiting room like they're home. And it's great. I love it. But then on the other side of things, I've also seen teens who have been dragged in sobbing like into my office. And then they sit down with me after an hour and they're like talking about their friends like we're old buddies. And it just takes warming up. But that's 100% stigma, because we'll talk about like, what ideas do you have about therapy? What does that say about you if you're going to therapy? It says I'm crazy. What is crazy? Who's crazy? I don't know anyone who's crazy, who fits in the crazy box, So I just think it's like this just general, I think it has a lot to do with the environment, the culture, and the way that the people around them are talking about or not even talking about mental health.
Right. Like, do you think that it's definitely something that medical professionals need to be better trained on? Like, that's probably opening up a can of worms. But just like some, like you've got some doctors that have a great bedside manner and you've got some that will look at you and be like, it's all in your head. Like, they don't want to dig into it. They just want to brush it off. And then you feel like you're gaslit and you're just, maybe I am crazy. And like, if it's if it's a mom that says, okay, I'm struggling with postpartum depression, or she goes in and she's like, my emotions are all over the place. Like, what can you do to help me? Rather than let's just pop a prescription at it, like truly asking questions and really digging into it before we automatically say, okay, here's a pill, just take this, it'll make you all better. But then in reality, it makes the situation worse because they just want her in and out of the office. Like, she's dismissed. So do you think there needs to be more of an education and a understanding around those types of situations with medical professionals?
Girl, that is a whole nother hour conversation.
I figured I'd be opening up a can of worms.
I was like, don't even get me started. I'm just going to say a clear abso-freaking-lutely. Like, are you kidding me? Like, to me, that's the whole body approach. Like, your body, your mind, your spirit. You can't fix one and not fix them all. And if a doctor is a perfect example, and I know we're kind of running out of time. I'll make it quick. I was 18 and was vomiting blood and had bleeding ulcers. There is no way an 18-year-old gets bleeding ulcers other than chronic stress. Period. But nobody asked me, what's your home life like? Nobody asked me that. Like, come on. Like, just, they should be somewhat aware. It's the same thing in corporations. I go in and I talk to corporations about trauma-informed leadership. Like, so many things in this world can just be fixed by just changing a few words. And if everybody was a little more aware, everybody would be a little more compassionate, a little more empathetic, and a little more open to the discussions. Because as long as you keep the discussions taboo, they're going to stay taboo. When you can normalize a discussion about the fact that my mother's an alcoholic or whatever it is, then things will start to make progress. But, like you said, they don't call it Cancer Anonymous, but they call it Alcoholics Anonymous and Drug Anonymous. And these are all things that, when you go to a hospital and you're an alcoholic, they have to treat you physically because you will die if you don't. It's a broken system. We got to fix it. But I will get off my little soapbox here because, like I said, that's a whole nother hour.
Yeah, I mean, I think it's also, I hate playing devil's advocate in this capacity also, but like I'm just thinking also like, medical providers have what they specialize in, and you can't specialize in everything and you can't be perfect at everything. They probably went into medicine because they're not born psychologists or therapists. And that's just what they do well. They do well with, in and out and with gathering data and fitting the person into like a box. I mean, that sounds like psychology too, but like medically, and with medicine, and that's just where they thrive. So I understand that, it's one thing, for us to sit here and to say, well, they should and they should, because we're not living their lives and we don't know what it's like for them. On the other hand, though, I think it would definitely benefit providers for there to be a lot more communication between the subfields. Like neurologists, for example, I struggle, I have a history of migraine. And migraine obviously is related to depression symptoms because, and by the way, a lot of other things like ADHD, PCOS, I'm not going to go down the rabbit hole, but like there's, I guess the bottom line is that like medical conditions often co-occur with psychological conditions. And because there isn't so much communication between a client's like therapist and pediatrician, due to lack of time or resources or, insurance not covering those phone calls, things like that, then it's hard. It's hard to actually make it happen. So it's like, yeah, there should be more communication, but then in practice, there isn't a whole lot of time and there aren't a whole lot of resources for that to happen.
Yeah, right. And that's where, it's, again, like you said, Tammy, that's a whole nother, like, hour show, if you will. Like, it, that could spiral into so many things. I won't even get started. On to the next topic. So, have you, and this will be the last question, but have you ever felt like with your own mental health struggles, like you've had to wear a mask just to get through the day?
In the past, absolutely, yes. I'm not there now, obviously. I mean, that was 30 years ago, and I have a whole bag of tricks to help me get through that, like, on a daily basis, but yeah, I mean, you literally could have said to me, like, "Who is Tammy?" And I would say, "Whoever you need me to be today." Like, I I'm whatever. I conform to the norm so that I don't stand out, so that I'm little, so that I did all that. Not now. Not now, of course, but yeah, there are times where I mean, it got ugly. It got really messy and ugly, and it had to get that way for me to finally say enough is enough. I mean, you have to have your why. You have to everybody has a why, everybody has a purpose, and find it, and you'll start to take one step out. But yeah, until then, there's a lot of masks being worn. A lot of people playing a lot of different roles and putting on that smile, and like you're like, like this, but underneath, like, I wish sometimes I actually had a picture when my mom died, and it was a picture of me in a clown costume. It was Halloween, and it had the big smile on the clown, but if you looked at my face, there was clearly a frown on my actual lips, and it was a really creepy, but it was almost symbolic of my life, and it was really that's what you go through when you have mental health issues.
Mm-hmm. Dr.
Yeah.
Gilly?
So feeling the need to put on a mask. I was actually having, it's the same person I was talking about before. I was talking to someone and, they're a therapist too. And so they asked me, and they have ADHD. They were like, what do you do toward the end of the day when you're starting to feel restless and your ADHD symptoms start to kick up? Because when you're with a client, it's like about the client. It's a very different interaction than when you're like chilling with a friend, like a friend you really trust. Um, aw. So, you have to be like there, present in the moment. And so what can you do? You need to mask. But the question is, how do you do it in a way that's socially appropriate, while also kind of getting the energy out? So my suggestion to her was, like if she's working with a kid or a teen, she can pull out a game like Mancala or Jenga and then sit on the floor, because then she could like stretch out her legs or move around, and it appears more normal because you're on floor rather than on a chair and like looking out the window and like, because you have to be still. So there are workarounds or like ways to kind of maintain things. But yeah, unfortunately, in professional settings, you have to mask it. It depends where you are. But the most important thing is that you can take off that mask when you come home. And in some situations, like in some relationships, it's harder to do than in others. And then that can lead to burnout. So think about like, how can you create that time for yourself where you could truly just like decompress and be yourself. It might even be just spending alone time. I like to sometimes be alone and just sit in a quiet space with my noise canceling headphones, and that might be enough for you.
Right? Yeah. Okay, we've got 1 minute left. Any final words that the two of you would have for today?
Have a nice weekend.
Nope. I was just going to say, if you're out there and you're listening, you're worth every step and every second and every penny you spend to make yourself happier. So you deserve it. You're worth it. You're loved. So know that. Thank you.
I love that. Well, thank you, ladies, for coming today. Next week, we will be back with, I don't even know what the topic is. I don't have it in front of me. Adam will post about it. But we will be back next week, same time. Oh, maybe he just messaged me. Oh, here we go. Safeguarding autistics during crisis is next week's topic. Same time, 8 p.m. UK time, whatever that ends up breaking out to be in the time zone that you're in, because we know we've got time zones, scattered all over the world of viewers that watch this. Make sure you like and subscribe, and we will see you next week. Thanks for joining.